As Women for Women's Human Rights New Ways, International Women's Health Coalition, and the Human Resource Development Foundation of Turkey, we welcome you to our panel on the sexual and reproductive health and rights and violence against women against refugee women and girls in the host countries. Let us start by saying you must have heard of the risk problems and microphone. Oh, it's not as good. Okay. Is it better now?
Yes. Is it better now?
You must have heard of the bombings in Belgium and Turkey, which are very sad. But I think we should think about all these issues. They cannot be told separately from the devastating war that's taking place in the Middle East and Syria, specifically in the recent years. While we're very much saddened and disheartened by these recent events, we wanted to emphasize here the interconnectedness of violence and the need for a holistic, gender-responsive and human rights-based humanitarian action to those affected by war and conflict with our panel. Today, refugee women and girls make up more than 73% of the displaced populations of Syria. Yet humanitarian action rarely analyzes and responds to the specific needs and situation of refugee women and girls. Here today, let us discuss and discern together to understand the conditions of the refugee women and girls and the violations they face on their sexual and reproductive health and rights, and the violence against women they face. Further, let us ponder together what needs to be done to ensure a gender-responsive, human rights-based humanitarian action so that these refugee women and girls are empowered to freely exercise and enjoy their rights in the countries they now live in. The situation of refugee women and girls, the news circulating on the exploitation they face on several levels, have moved Women for Women's Human Rights to take a closer look at the issue. With an experience over 20 years, we have from our establishment work on sexual and reproductive health and rights and violence against women, especially with disadvantaged populations. So we're currently in the process of brainstorming with major humanitarian action CSOs in Turkey to identify the gaps and the needs in the area from a gender equality perspective. Before I give the floor to our distinguished speakers, I would also like to convey the sincere apologies of one of our speakers from one of our co-sponsors, the Human Resource Development Foundation. As a CSO that works closely in the field with Syrian refugee women and girls, the foundation had to undertake a new and urgent program which preventing them from coming here, which I think is also very telling about the nature of the humanitarian work. You can find more information about the organization. They weren't able to be here, but you can find more information about them in their brochures on the back. We will start our discussion with the regards of Mr. Upala Devi from UNFPA. He is the UNFPA Technical Advisor on Gender-Based Violence and coordinator of the UN Task Force on Violence Against Women, based at UNFPA's headquarters in New York City. With an experience in working on development issues for the last 20 years, she has worked on many international mechanisms and institutions. She has contributed extensively to various books and journals, and has written a number of policy and technical papers on gender, gender-based violence, child rights, and human rights and development. Please.
Thank you so much. And I would like to begin remarks by really expressing my sincere condolences to the victims of today's terrorist attacks in Brussels. At the same time, I would also like to express my deepest condolences to what's been happening in Turkey over the last 1 year or so. Turkey is a country very close to my heart. I lived there actually last year for a couple of months in Istanbul. So I have got many dear Turkish friends, as well as Syrian friends. So for me, seeing what the world is going through, and as I said, it's all interconnected, nothing's really further from the truth. And as I was walking from the office right now, you could also see somehow that New York City also is in a state of heightened alert. And when you see that, you realize that nobody is safe anywhere, and we just got to do what we got to do with a lot of conviction and courage. So again, my sincere condolences to all the victims and survivors of today's blasts, as well as what's been happening in Turkey. So I'll basically speak a bit from what we do in the United Nations Population Fund, where I work as the gender-based violence advisor. And I'm going to focus my remarks for around 5 to 10 minutes on what the United Nations Population Fund has been doing globally on the issue of sexual reproductive rights and health, especially relates to victims and survivors of violence, as well as what it has been doing for displaced populations, women and girls, over the last 10 to 15, 20 years. Starting from natural disasters like Haiti, for instance, the floods in Pakistan, the floods in Burma, Myanmar, to humanitarian crises as they are unfolding right now in Syria, the refugee camps in Jordan, in Turkey, where I have worked as well for a number of years now. So, as we all know, for the United Nations right now, Syria really is the biggest humanitarian crisis with repercussions on the whole region, and not only for the whole region, it's for the whole world. And again, the interconnected nature of what's happening in Syria does have some linkages to what's happening with the terror attacks and so on and so forth. So, as the crisis in Syria now enters its sixth year, we see that women, men, girls, young boys, all of them from Syria face death, violence, displacement, and as a humanitarian organization, as the UN, along with other international relief organizations, civil society groups, we are really struggling to respond to the immense challenge of assisting and protecting people's lives and dignity. Among the affected population in Syria and refugees in the region, we have now seen that there are more than 4 million women and girls who are of reproductive age, who need special attention. That's a lot of women and girls. And this also includes nearly 500,000 pregnant women in Syria alone, inside the country, who are still struggling and who require services, in addition to the estimated 70,000 currently pregnant refugee women from Syria, who are now living in camps in Turkey and Jordan to begin with. So, just to give you some statistics and figures, as of now, we see that there are more than 12.2 million people who are impacted by the crisis. As I mentioned, there are more than 3 million women and girls of reproductive age. We have almost 500,000 pregnant women right now to speak. And there are a large number of displaced youth as well. 4 million displaced youth right now who are really struggling and who are braving all odds, as we speak, to cross the borders and are trying to find a new life in other countries as well. I'm also going to speak a bit more from the perspective of Turkey as well, because Turkey is a host country right now, and with the new international agreement that has been signed between Europe and Turkey in the last 1 week, we will see that Turkey will be receiving a lot of refugees in the next couple of years, and we will see that Turkey will also be facing challenges in terms of how it's going to respond to the crisis. We also saw in the last few days as that there are more and more refugees still crossing from Turkey, trying to go to Greece, and they are now being stopped. So the crisis unfolding, it's not going to stop, and how do we respond? So for instance, right now in Turkey, we have more than 1.6 million refugees from Syria and Iraq to begin with. We have again 500,000 women in Turkey in the refugee camps who are of the reproductive and childbearing age. We have more than 30,000 women in Turkey, including young adolescent girls in the camps who are pregnant, young girls as well who are pregnant. And then we have more than 300,000 youth as well in the refugee camps. So the statistics, the reason why I'm talking about the statistics is that they are quite mind-boggling. And as we grapple with the facts and figures, we're also realizing that what human organizations, the UNFPA, the United Nations Population Fund, other sister agencies like UNICEF are grappling with in terms of the resources, the fiscal resources, and in terms of staff capacities, is not enough. We don't have enough at this point. We are really struggling. So in terms of UNFPA and what we do, we are working closely with affected populations, community-based organizations, local international NGOs, governments, and other UN agencies like UNICEF, like I just mentioned, and working with them in the camps from where the refugees have arrived. Mainly these camps are in Lebanon, Jordan, Iraq, Turkey, and Egypt. But again, we are doing a lot of work in Turkey because Turkey really has become a host destination point for the Syrian refugees as well as refugees from Iraq. So in all these settings, but particularly emergencies, women and girls have the right to access affordable reproductive health care, including anti- and postnatal care, safe deliveries, and family planning. And for us as UNFPA, what we're struggling with is that we deliver a lot of family planning kits because in situations of crisis, what we've seen is that more women get pregnant actually. And this I've seen in Haiti, I have seen this in refugee camps globally, that when people are in a heightened state of crisis, people also indulge a bit more in risky behavior, so to speak, and then they don't have the services in terms of how they're going to meet their needs. So for us, it's been a big challenge, and for us, not only are we trying to provide them with counseling, medical services, post-antenatal care, but we're also trying to provide them services in terms of access to family planning and access to safe sexual practices. We are also seeing that in many of these camps, while fortunately the HIV prevalence rate is very, very low, and which is fortunate because globally the HIV prevalence rates have gone down, we are still trying to educate young people about safe sexual practices because we do not want to be in a situation where we have many young girls who are already getting pregnant. And that's happening over and over again. So in terms of what we're trying to also do is that in Turkey, we've been training staff members across the country. We've been cooperating with refugee programs in Sanliurfa, Mersin, and Gaziantep provinces, of course. We are looking at distribution of hygiene kits to refugees in Southeast Turkey. We are looking at also providing brochures in both Turkish and Arabic because we are realizing that just providing Arabic brochures is not enough. And as Turkish refugee workers are going to camps, they need to be themselves educated because a lot of these people who are now going to the camps are first-time refugee workers to begin with. So we are doing bilingual counseling and then we're also looking at expanding women-friendly spaces in the camps, counseling services, carrying out awareness-raising programs on gender-based violence. We are strengthening the capacity of service providers in the field of reproductive health. We are working with different ministries, and we are continuously trying to improve the quality of services responding to gender-based violence through effective monitoring and evaluation mechanisms, because what is happening is that in many of these situations, many organizations are working, but we are not well coordinated enough. So what we're trying, for us, the challenge really has been not only just in terms of fiscal resources, in terms of staff capacities, but also in terms of coordinating with other agencies who are also working.
So you want medical experience industry? Okay.
So just to end by saying that there is also a very pertinent point that I wanted to bring across to all of us women across the table is that the refugee country is not just, refugee situation is not just detrimental to the host country in terms of the challenges that it faces in looking after the populations like Turkey, for instance, or Lebanon or Jordan, but it's also a big challenge for the sending country as well. And in this case, I'm talking about Syria and Iraq. The brain drain that's happened over the last 6 to 7 years from all these countries is, again, unbelievable. We are looking at midwives, nurses, professors, doctors, lawyers, and Syria is an educated country. And we are seeing now all these women who are living in these camps without any access to any economic measures to begin with. And that for me has been a very challenging situation as well, because in the UN, we are providing them with services, we are providing them with medical care, we are providing them with education, we are providing them with gender-based violence referral mechanisms, we are providing them with a lot of awareness tools. But what we are not being able to provide them is with sustainable livelihood mechanisms. And for me, seeing a lot of these women who are now suffering, not just physically, but psychologically as well, because they don't have access to what they've been doing for their lives to begin with, that they have left in terms of going out of their houses, earning a livelihood, meeting with other people, earning a living, doing what they want to do in terms of the fact that they are educated women. That has been a very, very big challenge for us. And I end by saying that for me, that's one of the biggest challenges that the United Nations is facing right now when we are working with these refugee populations, the issue of brain drain. And we are not just talking about brain drain as it relates to men, but we're talking about women as well, that we have a lot of educated women who are living in these camps who are right now trying to do not have anything much to do, just waiting for just waiting for the next day to arrive, and many are psychologically very, very depressed. And we don't have a mechanism of dealing with that to begin with because economic referral systems in these refugee camps to set those up are very challenging. So I end by saying that again, this is not a situation that's going to be stop in the next couple of years. We are looking at, as I mentioned, the largest humanitarian crisis in history. And even if the refugee exodus stops over the next few years, in terms of looking after the needs of all these people who've already fled these countries, is going to be challenging. In terms of settling them would be challenging. And we're really looking at a long-term humanitarian assistance plan that will be unfolding in the European Union in the next couple of years along with the United Nations. So thank you so much. And again, just to mention that I also salute all the different international organizations that are here, all the women out here, because all of what you do really also, gives us the impetus to move on, because we, at the end of the day, United Nations cannot survive if we do not work with international women's organizations and groups like you all. So thank you so much for that as well. And of course, I'm happy to respond to any questions in terms of, what we are specifically doing, or in terms of if you want to have any context with us in terms of what groups we work with in the camps. I'll be happy to provide you more information on that as well.
We thank Ms. Levy for her contributions and signifying the importance of coordination, and cooperation between women's rights organizations and humanitarian action organizations, as well as UN agencies and governmental agencies. Maybe we could prolong at the next level. We now turn to Ms. Françoise Girard, who will share with us the specific burdens girls face in refugee situations and what international mechanisms and tools we have, especially with the recent 2030 agenda, that will ensure that we are able to have a gender-responsive humanitarian action on the ground at all levels. Ms. Girard is the president of the International Women's Health Coalition and an advocate and expert on women's health and human rights, sexuality, HIV, and AIDS. She was the director of the public health program at Open Society Foundation and has been a consultant to WWHR, IPPF, and DAWN. She has played a key role in advocacy on reproductive health and women's rights with UN agencies and at UN conferences. Please, thank you.
Thank you, Şehnaz, for the invitation. I want to really thank Women for Women's Human Rights for organizing this very important panel at this time, particularly today, all the more important given the crisis unfolding in Europe and in the region. And actually, I began my career in international human rights working on issues of migration. The first year of my 20-plus years of work in this field were specifically on these issues. So this is definitely a set of issues that is dear to my heart. I'll say a few words about specifically, and our colleague from UNFPA alluded to that, the particular situation of women and girls in refugee situation or situations of displacement. The health of women and girls in these situations, which may not be that great to begin with, depending on where they lived, is clearly threatened by the severe living conditions that are experienced by most refugees and displaced persons. And of course, there are places where the situation is much worse to start with than Syria, such as Somalia, Sudan, South Sudan, and the Central African Republic. We have many crises unfolding around the world where women leave places where their health and their access to healthcare is already very poor, and then they flee to some other very poor country where the situation is equally dire. So there's a lot of hardship that comes out of that. Of course, in the case of the Syrian crisis, and particularly in Europe, that should not be the case. But it is. And it's a great shame, I think, that this kind of hardship should be experienced by refugees across Europe who have come out of Syria and Iraq. It's in fact, we've seen appalling conditions imposed on these people, with people camping in mud in fields in Macedonia or behind fences in fields all over the summer in Europe. This is outrageous, inhumane, and it's a violation of international obligations of Europe, and frankly, we need to speak up about this. Now, women themselves, when they become refugees or displaced persons, bear, of course, all the dangers that men will face, but additional dangers associated with their flight. Physical trauma, of course, psychological shock, the stress of having to care for small children quite often while on the run, living in chaotic environments which leave them open to sexual violence, to rape as a weapon of war, and also to sexual exploitation, often and abuse as counterpart of payment to obtain transportation, smuggling, or protection for their children. And that we've heard many stories about that. Women also lose access to their regular contraceptive methods in crisis situation, and so they do face the real heightened risk of unwanted pregnancy and consequently of unsafe abortions, clandestine abortions. In fact, UNFPA in one of its reports estimates that half of maternal deaths in refugee settings may be caused by unsafe abortions. Half all maternal deaths in refugee situations may be caused by unsafe abortion because women have lost their access to contraception. There's also, of course, the risk of sexually transmitted infections, HTI, and so on. As I mentioned, rape and, coarse sex, and, of course, life-threatening pregnancy and childbirth in unacceptable conditions. And we've seen, in addition to that, including in the Syrian case, forced marriage, especially for very young girls, where families at wit's end as to how to deal with the situation and in the hope of protecting their daughters, marry them off as young girls. Now, there are a number of things that have been done, in thinking about the framework for dealing with these situations. There's a number of things that are worth mentioning. One is that international human rights, such as they are, and the body of human rights has been built over the last 60 plus years, international human rights apply to all people, regardless of citizenship or legal residency. The non-discrimination clauses in both the International Covenant on Civil and Political Rights and the International Covenant on Economic, Social, and Cultural Rights ensure that there should be no discrimination in treatment on the basis of any status, other status, and that would include migration status. So under international law, all individuals within the territory of a country should be treated equally. Now, as we know, in reality, we have a very different situation, but just so you know, that is actually the norm. And so that means that the right to health, the right to security of the person, the right to education, the right to life, the right to social security, to decent work should be the same. Of course, the reality is different. There's also the Refugee Convention, which is an older document from the 50s and which has been very widely ratified. And it states that refugees lawfully staying, that's an important phrase, but refugees lawfully staying in a country should be treated exactly the same as nationals, as citizens, with respect to social security scheme, healthcare, education, and so on. Now, the whole question of lawfully staying is often what is raised as, the problem, but nevertheless, there's, millions of registered refugees in a lot of the countries in question, and they certainly should have exactly the same treatment as nationals. And finally, you might be interested to know that the CEDAW committee, the Committee on the Elimination of All Forms of Discrimination Against Women, which is the treaty body in charge of the interpretation and the application of the CEDAW Convention, issued a general comment on the right to health in 1999, highly recommended, the general comment on Article 12, which says that governments must ensure access to reproductive health for all women and girls, and I quote, even if they are not legally resident in the country. So they, on the issues of reproductive health, given the specific vulnerabilities of women, the committee stated that it doesn't matter what is your legal status. In fact, the obligations under CEDAW mean that countries should provide reproductive health care without discrimination. And in particular, the committee noted that special attention should be paid to the health needs and rights of refugee women and internally displaced women. So we have tools there in international law that are extremely important. There's also, in the field of refugee coordination and policy, and my colleague knows this very well, a series of tools that exist to help all the agencies trying to deal with refugees address the question of reproductive health. There is an interagency working group on reproductive health in crises that was established in 1995, so its work is more than 20 years old. It includes all the UN agencies involved in refugee crises, plus a whole range of donors, as well as many of the international NGOs that we're all familiar with in refugee situations, such as the International Rescue Committee and Médecins Sans Frontières, CARE, and many others, and as well as many research institutions. So together they formed the Interagency Working Group on Reproductive Health in Crises, and they have issued a field manual which details what should be done in emergencies and has broken up crises in sort of immediate response and longer term response and so on. And there's a minimum initial service package of interventions that is defined there for what should be done immediately in crisis. So we can't say we haven't thought about this, and we can't say it's not been defined, and we don't know what we should do in the first 3 months, and we should do in the next 3 months. We have thought about this, we've written it down, and it's actually very, very clear and very specific. And in 2009, the field manual was revised to actually deal with some issues that had remained a little under-addressed. For example, the whole question of HIV prevention, which had been left to the side, as well as the availability and the access to emergency contraception. In the first version of the field manual, emergency contraception was to be given to women only if they've been raped, in the context of sexual violence. Now, the agencies have recognized that emergency contraception should be available as with all modern contraceptive methods to anybody who needs it, whether or not they've been raped. And then abortion, which was left to the side in the first version of the field manual as only post-abortion care. So we left women to deal with botched abortions, and then they could come and get health care after that. Now the field manual makes it clear that abortion should be provided as allowed by national law, the law of where the refugees are. So in a lot of cases, the law provides for a broad range of exceptions for rape, etc., including the health of the woman, and agencies such as Médecins Sans Frontières have actually used that pretty actively to provide safe abortion. So that's some of what is available in the field to coordinate this. And then finally, we have the Sustainable Development Goals, which were adopted last September, and which are 17 goals to address economic justice, social justice, peace and security, and climate justice. This the framework for sustainable development for our planet and our humankind for the next 15 years. There's not a goal specifically on migration or refugees, but vulnerable populations, people in vulnerable situations are mentioned throughout the framework in almost all the goals. So if you assemble all the targets that deal with people in vulnerable situations, you actually have a target on social protection systems, including social protection floors for vulnerable people in vulnerable situations, access to safe and nutritious food under Goal 2 under hunger, access to education and vocational training for children in vulnerable situations under the goal on education, so that specifically is addressed, access to adequate sanitation, especially for girls and women and people in vulnerable situations, and girls in camps and not in camps. So that's the goal on sanitation and water. There's a target specifically addressing the question of trafficking in women and children and sexual exploitation in situations of vulnerability. Labor rights, orderly, safe, and regular migration through well-managed migration policies is addressed in the Sustainable Development Goals. There's a specific target on that. And finally, two other targets, one on safe, affordable transportation systems, including for vulnerable populations. That's been, as we know, the whole question of transport has been a massive issue in the crisis in Syria. And then an interesting little target on reducing the cost of migrant remittances. Two, we thought, but even that issue has been addressed in the SDGs, to reduce the cost of, when you send money back to your home country, to less than 3% of the money that's sent. And of course, there's across the framework a set of goals and targets that apply to everybody, including migrants, such as universal access to sexual and reproductive health services, education and information, reproductive rights for all, free and primary and secondary education, including for girls, and a target specifically on child early and forced marriage and female genital mutilation. So with all of these tools, with all of these agreements, these field manuals, etc., we have a lot at hand if there's only political will. And so I think it will be incredibly important this summer, in May, when there's the humanitarian summit in Turkey. Turkey is hosting the World Humanitarian Summit in May, that a gender perspective on the refugee crisis be really placed at the center of what is debated there and what is agreed there, because we have agreements, but we now need to put it in practice. Thank you.
Mm-hmm. Thank you so much for giving us a brief overview of the tools we already have, which are actually quite strong, if only implemented on the field.
That's right.
And those under the 2030 agenda and the SDGs, and also emphasizing the need for political will, which I think is one thing that we need to advocate for very strongly, to be present in those areas. I'd like to now turn to Ms. Cavlan from the Federation of Women's Associations in Turkey. She will give us an overall picture of what's happening in Turkey and the numbers and statistics, and there's a few quick facts. Elçin is a feminist activist working voluntarily in women NGOs for the last 12 years and professionally working with Syrian refugees for the last 3 years. She is a former fellow in Columbia University and has various studies regarding the immigration and the women in peace processes. Please.
Thank you very much, and I also want to start sharing my deep condolences regarding the terrorist attack in Belgium. I'm from Ankara, the capital of Turkey, where in less than 6 months we had 3 different terrorist attacks, and around 200 civilians were murdered somehow, and the real hands behind the curtains are still suspicious. So I personally share their concern of living under the terrorist attack, fear, the trauma regarding this. So I mean, I just wanted to share with this very personal comment and sharing condolences regarding the terror attack victims today in Belgium. Before I give the floor to my colleague who's gonna give you deeper information what's really happening in the field of Turkey, I just wanted to put some remarks like the quick facts and numbers we have in Turkey, because the official numbers and the unofficial numbers regarding the data of the refugees in Turkey are not clear for us. So the real numbers, we are talking about the Syrian refugees in Turkey is around like 3.2 million. However, in the real numbers, we are talking about a little more than 4 million, which is now the 5% of our total population in Turkey. So the number of Syrians who have fled the civil war climbed to over 9 million by the end of 2015, and another 7 million individuals are displaced within Syria. And according to the official numbers, as I told you right now, 3.2 million Syrian refugees are now registered officially in Turkey, and the unofficial number is a little bit more than 4 million, but we don't really know. And 75% of the total refugee population in Turkey are women and children. And UNHCR states that Syria's development status has regressed by 5 decades as a result of the crisis. More than 13 million people are currently affected by the violence as a result of the civil war in Syria, and it's rising. And 7 million have fled their homes and now they are internally displaced. 6 million, and it's again the official number and we have no idea about the unofficial number again, 6 million people have become refugees and they have fled to neighboring countries, Lebanon, Jordan, Iraq, Turkey and Egypt. How they are immigrating now to EU is completely another story. And UNICEF estimates by the official number, September 2015, that 75% of the total 75% of the total refugees are women and children. My colleague will give you some information regarding the camps in Turkey, but before that, I just wanted to give you very brief information that there are now 20 functional camps in Turkey. They are all based on the Syrian and Turkish border, and 20 of the total amount of the refugees in Turkey are based on the camps. However, camps are not open for the international or national monitoring by any NGOs. Only some UN agencies are allowed to access the camps.
UNHCR only at the second year of the crisis.
Okay. So, I mean, as a women NGO, we are not completely allowed to access any camps in Turkey, so we are not allowed to have any monitoring mechanisms there. So, data collection regarding the refugees in camps and the urban refugees are not systematic at all, and so not transferred. And unfortunately, we are not able to access to have any gender disaggregated data regarding the Syrian refugees in Turkey. And ongoing analysis and research is absent in order to better understand the gender-specific vulnerabilities of women and girls particularly, and to examine whether such vulnerabilities increase as a result of extended displacement. So this is a very overall picture, just to give you a very quick idea. The findings from Turkey reveal that rates of early marriage are high, and as a significant percentage of children are the main resources for the household income of in Turkey. And the restrictions of the mobility of women and girls constrain their participation in social and economic activities and their access to basic services. As the overwhelming majority of the refugees in Turkey do not have any employed any income generating activity. Very recently we have the official working permit for Syrian refugees, but unfortunately we don't have any gender-based income generating or vocational mechanisms regarding the Syrian refugees as well. So whenever we are talking about the Syrian refugees, especially women and girls in Turkey, and we shouldn't think about the early marriages as one of the main sources of the problems. As the absence of the psychosocial support for the survivors of gender-based violence and the confusing and poorly structured approach to the provision of reproductive health care are the two biggest contributing factors to female disempowerment in the camps in Turkey. And last but not least, the systematic avoidance and near zero systematic data of the urban refugee population, of which women and children are likely the majority based on the assessment of urban spaces, stands to further complicate the overall picture of Syrian women living in Turkey right now. I have some recommendations to think together, but before that I want to leave the floor to my colleague, and then if we have time, so we can a little bit discuss about the recommendations, just very particularly regarding Turkey. Thank you.
Yeah, hi everybody.
Can I introduce you first? Özgül is very ambitious and willing to work on this agenda and convey her messages to you. But Özgül is a member of the Women's Solidarity Foundation. She is working with refugee women and girls on the ground. She's a professional social worker since 2013. And she is the member of the Women's Solidarity Foundation since 2003 and an independent activist since 2003. She also works on the travel industry, trade fair organizations and rural management, and holds a psychology degree from Middle East Technical University. Thank you.
Hello again. It's the most word maybe we are here. Child marriages we heard. Of course, this is not the only form of violation against women and children in the region. We met a lot of other forms of domestic violence as well. But it's the worst one that comes very, very sad to our ears, actually. I would like to start my words on this huge issue with a typical telephone call with conversations we are sometimes receiving in our organization, Women's Solidarity Foundation. We receive such calls that asking for our help to find a woman who would carry on domestic care services, mostly for care of an elder man or ill man. The reason why they call us instead of employment agencies is to find the deprived woman, violated woman who need a shelter. In most of the cases, the idea of the background idea is to get married with a religious way, with religious nikah. We call it muta nikah. The last call like that I received a few days ago before I moved here was from a man living in the central districts of Istanbul. He told me that he needed a woman for himself. He is elder but not ill, and he has got enough money to feed a woman, but he do not prefer a Syrian woman because the last woman he had was a Syrian. He wasn't happy with her care. This is the typical sentence, shows us many facts, how it's going, how this situation goes on, how it is being normalized, etc. From that point, I feel I have to describe a little bit the situation in terms of local citizen women in Turkey. Yes, I'll pass this part fast. Maybe you are familiar with some cases. Since, Turkey has adopted many policies and many laws, international legal agreements and arrangements. But inside of the country, we live a situation just vice versa. We cannot speak of, for instance, the implementation of Istanbul Convention. Any sentence, even in some, according to some rumors, we hear that some people once the Minister of Family takes the recruitment back. I hope it's only a rumor. Laws are perfect, regulations are perfect, but policies are turned back at least 30 years back of Turkey. So we have to look at the situation of migrant women in that preview. There's nothing to do with this citizen. The policies doesn't save citizens women from violence, and as well as migrant women. The summary we made about the women in Turkey above is even more the case with the migrant women in Turkey. Being foreigner and unprotected aggravates this administration. The women who migrate alone, live and work as being very open to violence. Syrian, Afghan and Iraqi women who migrate with their families, in addition, are the subject to domestic violence. They are not protected from the guns of women and sex trafficking. Syrian girls and women who compose of the largest migration population are being sold by muta marriage as second or third wife Divorce in that situation is being legitimized under the pretext of good deed. They are forced to live in houses in worse conditions in all cities, and they experience the burden of the rules at home in much aggravated way. They are forced to work in formal workplaces and domestic care work without security and with slave-like salaries. Syrian women who have no means to work, even if they could find a work under acceptable conditions, since they carry the burden of childcare of their own with a lot of children. The average number of children per Syrian families is 5. And there is no kindergarten opportunity for the women, either for Turkish women as well. They are unable to access the services like health and education, especially in the big cities like Istanbul, Ankara. Syrian women cannot move because of the poverty and the burden of kids, especially, and also the, how shall I say, fundamental pressure within the family. Regulations about migration just made a few years ago, 3 years ago. Required legal regulations were not made until 2 years after the Syrian crisis, although Turkey was an intensively migrated country since the 90s. The law of foreigners and international protection doesn't consist any gender-based protection measurement except for the security-based measurements about women trafficking. Family and Social Policies Ministry and Violence Prevention Centers are being addressed in terms of protecting Syrian women from gender-based violence. However, these centers are not sufficient even for women from Turkey. This is not even in the agenda of Family of Social Policies Ministry Action Plan for Struggling Violence Against Women. Yet the social policies about gender-based violence doesn't include as a whole plan, including the migrant women as well. There is not even any effort being paid to put in practice Istanbul Agreement's relevant issues. Discrimination is towards Syrians. There is a 50-50 situation sometimes. We heard that originally Kurdish Syrians are not treated by their same ethnic groups if they are able to live together. And originally Alevian groups the same. To some extent, Syrian people get some support from the Turkish population and get solidarity. But it's not something general. It doesn't something to solve all the problems. It's only working in the charity level. There is no social policy being carried out against labeling migrant women as evil women, seduce women, Turkish men, which is a label and circulates in social traditional media very often. the Syrian population can benefit from social solidarity and only at the humanitarian aid charity level. The fact that the aid targets the Syrian population only creates disturbance among other migrant groups. The fact that Syrian population is referred for unsecured, underpaid work instigation, discrimination against the Syrians among the Turkish population who had been working at those jobs before and also among the other migrant groups. Yeah, as a result, this issue actually requires international solidarity and women organizations to be involved in the sequences and the plannings. Yes, there is too many organizations, international or national, trying to formulate solidarity for the Syrian population in Turkey, especially UN organizations that are dealing tremendous role together with international other national organizations. But humanitarian aid action doesn't have the capacity and capability of working in terms of gender equality. It's not a matter of telling the rule that gender discrimination is not allowed. To put into implementation is something else. We tried this with a humanitarian aid organization in Turkey. We tried to work together. We are still working together since 3 months. At the beginning of the work, the staff of that organization was treating us as they are doing some favor for us. After the 3 months, now they are saying, please don't leave us and please train us in terms of gender equality.
Thank you so much, especially for giving us real life stories and presenting us a picture of how things are working for those refugee women and girls outside of the camps as well, which actually constitute 90% of the Syrian refugee women and girls. They're outside of the camps at this point. And also, thank you so much for mentioning the Istanbul Convention, which is a Council of Europe convention, so a regional convention on violence against women and domestic violence. It is important on many instances, but I think it's very relevant to the case of refugee women and girls and the violence they face, especially in Turkey. Turkey is the first signatory and ratifier of the convention. And the convention states that member states have an obligation, signatory states have an obligation to protect all women in their soul or on a ship that has their flag. So, anyone in their constituency to against violence against women. And Article 4 of the Convention specifically mentions that migrant or refugee status cannot be grounds for discrimination when applying the Convention. So, so it's a very important regional tool we have for Turkey and Europe when dealing with these problems and situations, violence against women, cases refugee women and girls face. I think we have a little bit more time. Would you like to give your points for our discussion, and then we can wrap up and go to questions?
Hello again. So I will give you very few recommendations just to brainstorm together. After now all the information regarding Turkey, the recommendations are not just limited with the Turkey, but of course it's based on my experience of my fieldwork in Turkey. The first recommendation could sound a little bit general, as I start with stating that we don't really listen to refugee women and girls. I mean, we are running so many needs assessments in the field, but as I told you very recently, as we don't have the gender desegregated data, all the needs assessment at the end is very limited. And I don't think that women and girls' voices is the key force in driving humanitarian action at a certain point. And the recommendation is UN agencies, host and donor governments and NGOs must seek out and value the perspectives of women and girls who account more than 50% of the refugee population overall, or I mean to be more precise, 75% of the total population. And this value is demonstrated by acting on what women and girls identify as prioritized and designing programs to that end. And standards in the humanitarian response would be a very important second recommendation at that point, because, I mean, as we all agree, women and girls must be safe from gender-based violence as they seek refuge, and the UN should commission a regional real-time evaluation to assess the application of minimum standards as laid out in the interagency guidelines for prevention and response to GBV. This real-time evaluation would apply to cross-border work in the northern Syria, as well as in camp and refugee areas in Turkey, and of course this could be also very important for Jordan, Lebanon and Iraq as well. I'm not talking about the EU processes as they have different mechanisms, but I'm talking about the region that we are in. And the third is the individual registration of women and girls in terms of taking the refugee status. Women and girls should have a safe and accessible access to individual registration in both camps and the urban settings. When women are not registered, are only registered under the male head of the household, certain risks are increased and women may experience difficulties in overcoming barriers to the services they require. Their own registration is extremely important and to protect the women from deportation, and UNHCR has recently made very positive steps in this regard, but is still on the process how a woman and girl will be able to have their refugee status as herself. And I mean, as my colleague previously said, in Turkey there are, hundreds of very well trained and very well equipped staff we have. Not only the national or international NGOs, but all the support coming from UN agencies. But still, for example, where a split in the family case is necessary due to the domestic violence, case need to be quickly assessed by the protection officers trained, especially for GBV, and to determine the best interest of women and girls affected. Because very recently cases in Turkey regarding the Syrian refugees who are the victims of domestic violence, they are completely not sure to apply to any local agency or either to go to the police because they are under the risk of deport. And fourth and last, women and girls in Turkey, from protection to prevention and at the end empowerment. UN and the humanitarian organizations, national and international, must recognize the domestic violence as an imminent threat to women and girls' protection, increase understanding on the causes and consequences of domestic violence, and definitely prioritize funding to design multi-phase interventions to both respond it and at the end prevent it. Unfortunately, we are not on the phase to prevent the violence yet. We consider this as an emergency issue and we are still on the phase for protection, and we have no mechanisms at all regarding the prevention and empowerment. Thank you.
Thank you to all our distinguished speakers who contributed immensely to the discussion. Before I open the floor for questions, I'd like to sum up a little and then bring out some points and calls from this panel. I really want to say that we're very much concerned about the level and the content of negotiations between EU and Turkey, which are finalized, but the implementation process, I think, can benefit from a gender perspective discussion. Unfortunately, the keywords of the discussions have been closing of borders, how much money will be given, billions of euros, how many billions of euros, better border control, while the issues and the terminology of human rights, the right to education, women's rights, gender equality, health, access to health services, have been lost in the margins of the discussions, unfortunately. So we urge the governments to make the necessary connections between this humanitarian action agenda between EU and Turkey with the agenda of 2030 of the SDGs and with all international commitments and conventions that are already in place. And we ask the EU, which we know haven't given most of the money to Turkey yet, to allocate the money it's going to give to SRHR services and the prevention of elimination of violence against women, to separate that amount and to make sure that the money goes to such services when it's reaching the refugee women and girls in Turkey. Of course, this is a message to all the funder organizations as well, that while humanitarian action is very important, lacking a gender perspective, it will not be as effective as it should be on the ground. Like Elçin has mentioned, the active and effective participation of refugee women and girls in the decision-making, planning and implementation of these programs are very much crucial. So we invite all of you, if you have connections to such organizations, organized Syrian refugee women, especially in Turkey but abroad, if you have connections to, please contact us to make sure we can involve them in the processes that we're hoping to implement in the future, and also maybe make connections with them in Turkey as well, so we will really appreciate that. As a last point, I want to thank Ms. Françoise Girard again for mentioning the World Humanitarian Summit, which will take place, it's the first one ever, and it's hosted by Turkey, and it will take place in Istanbul between 23rd and 24th of May this year, so it's only 2 months away. But we need to ensure that there's a strong gender perspective to address the issues and find the solutions to the problems we have discussed in our panel today. A gender-responsive humanitarian action is necessary to ensure full access and enjoyment of the rights and freedoms of the refugee women and girls. And we welcome, actually, and support very much the possible inclusion of a call to the World Humanitarian Summit in the agreed conclusions of CSW60 to ensure a fully integrated gender perspective in its deliberations, and later on the implementation of the outcomes of the conference, which is nearly there in the recent revision. So we hope that that will remain and be a strong call to the World Humanitarian Summit from the CSW. We thank you for your attention, and we can get some questions from the ground, maybe a few, and then we can get the answers from our panelists and then continue like that. Yes, please.